Now, one thing you mentioned also is that this kind of happens in an older population, but I'm just wondering, are there other populations that might be at risk, maybe not just senior citizens, but who else might be at risk for osteoporosis?
Sure. As I previously said, for the most part, the screening for osteoporosis starts at 65 years of age. It's most commonly seen in women than males, but males may also experience osteoporosis as well. But yes, there are other younger populations that may experience the development of osteoporosis as well. For instance, patients with chronic conditions like rheumatoid arthritis, or also patients on chronic steroids use. And steroids or prednisone is something that we basically use often. And its chronic use, for the most part, after 3 months of use, may increase the risk for osteoporosis. And there are other medical conditions as well that may lead to osteoporosis in a much younger age.
Okay, and you did mention, of course, I think most people do know that women are affected more by osteoporosis. Is this, again, is it a hormonal reason that this happens, or what is the reasoning behind that?
Well, for the most part, yes, it is related with hormones. After menopause, there is less estrogen and progesterones, and this leads to resorption of the bone, or demineralization or bone loss. Yes, it is mostly related to that, and like I previously said, it's most commonly seen in women than men.
One thing I noticed on that graphic, doctor, is they also mentioned other risk factors might be your race as well as your body size. So what races seem to be more affected by osteoporosis?
For osteoporosis, for the mostly, Hispanics are highly affected by osteoporosis. In terms of body weight, I was reading an article that mentioned less than 128 pounds. But for the most part, I would say patients that are thin with a body mass index of 18%, they're much at a higher risk of osteoporosis.